Hello and welcome to our first study group of 2022. We are just incredibly pumped to have Holly Lloy with us from Invisalign to kind of go over a few of the things that she can help with our practices. We have lots planned for this 2022 office manager study group. So we're super excited to kick off this year with Invisalign because more and more general practices are investing into it, and with 3D scanners and clear aligners, we're just seeing a huge turn in what can be done in general practice, and it's super exciting. But on the flip side to that, we really need to kind of learn how to manage it. So we're super happy to have Holly here with us. Holly was, or still is, actually an RDH, which is a registered dental hygienist. She's been doing that for 9 years, and then she's been in dental sales for around 8 of those years as well. And we have seen she's in different positions and kind of different roles in dental sales. So she has been like all over practices, kind of the ins and outs of everything, which is obviously such a huge asset for her new role, which is obviously Invisalign. She does training and skill development, as well as teaching you about the fundamentals, and then also the financial and goal setting and all the kind of stuff that goes into operating this part of the business, which is pretty exciting to have you here. So thank you so much, Holly, for coming on tonight and for being a part of this study group and offering this kind of information for us to kind of learn and grow with in our practices. And I'll turn the time over to you.
Awesome. Well, thank you guys so much for having me today. I'm really excited to go over some of what we do over here at Invisalign. We're going to go through kind of like a basic overview of one of the trainings and presentations I do. If you guys have any questions as we're going through, feel free to jump in the chat box, raise your hand, come off mute and ask the questions. I'd rather answer them as we go so we don't forget about anything. Okay, so we don't have anyone on video, but can we do a show of hands? Anyone that's in here right now, is your clinic currently offering Invisalign? So we have Brianna, I can see. Let's see. Oh, in the chat, perfect.
Yeah, Jenny said too. She's
awesome. Anyone else doing Invisalign? Is anyone interested in offering Invisalign in their clinic that currently isn't? Okay, awesome. Okay, so we're going to talk about why we are talking about Invisalign and why it is important to the practice. Okay, so dentistry has kind of changed over the last several years. And we're moving towards more proactive dentistry and less reactive dentistry. And Invisalign fits into this role really, really well. Okay. So why do we talk about tooth movement? Why are we discussing malocclusion? And one of the questions that I love is malocclusion a disease? Does anyone have any insight on that? Anyone? You can pop in the chat. What do you guys think? There we go.
I actually have no idea.
Really?
Yep.
Okay.
You're going to teach me something new today.
Okay. So according to the World Health Organization, malocclusion is actually listed as a disease. So if we think about it this way, if malocclusion is listed as a disease by the World Health Organization, do we as healthcare professionals have an obligation to diagnose?
Of course. I mean, it would just make sense to be able to fix a problem you know is there. And it's so incredibly helpful just for like chewing, because if you can't chew, you can't eat. And if you can't eat, you can't live. So it's like a bare minimum things.
Exactly. So it's really, really important. So yes, we're going to diagnose malocclusion. We're not always going to be able to treat it, and the patient's not always going to be open to having it treated. But if we don't at least diagnose it, it's essentially supervised neglect. So something to keep in mind and kind of change your thinking when it comes to talking about malocclusion with clinics or with patients in your clinic. Okay. So when we're setting up a clinic for Invisalign, there are 4 pillars to a successful Invisalign practice. Number 1 is clinical knowledge. Okay, so you guys are here tonight, you're getting some more knowledge, you're doing some CE, that's awesome. But with Invisalign, there is so much to learn. Essentially, a doctor starts out with the basic Invisalign course, which is unfortunately online now due to everything that's going on in the world. But after that, we have so many different layers where doctors, clinics, office staff can all participate in the knowledge and the learning with Invisalign. We have online CE, we have in-person CE, we have a program that is called Invisalign Pro. And essentially what this is a one-on-one tailored program that Invisalign offers to our doctors. And you're able to select which courses you would like to learn about, which is amazing because you're not just going in and getting exactly what they are offering. You can select which topics are important to you and then invest your time into those topics. Okay. Tons of webinars with Invisalign. If you're ever looking for anything, reach out to myself or your other Invisalign rep, and we can definitely make sure those are sent out to you. And then you also have myself and the other Invisalign reps who are able to go into the clinic and provide one-on-one training with yourself, the team. And this also includes any of the staff that are working on the financials or stuff like that as well. Okay. Next, financing. This is a very important pillar when it comes to Invisalign. There are so many different layers when it comes to financing, and it is really important to get this right. When I go into a clinic and they're like, you know what, we're not getting a lot of case acceptance, or, patients aren't really saying yes, a lot of it boils down to financing. Okay. So what are we charging? Okay. Based on all the different options that come with Invisalign, then how are we breaking up our payments? Which codes are we using? Right. What are we asking for a down payment? Who handles these types of conversations in the clinic? Do you have someone who's an Invisalead? Is there an office manager that's taking over this? Whoever is responsible when it comes to financing needs to know it inside and out, because these patients want answers and they want correct answers. Okay. So when it comes to financing, typically what I do is this is like a full one-on-one meeting with a doctor and who's ever taking over the financials. And we kind of lay out what is going to work for the clinic. And maybe we can also, like, if this is something you guys have been doing for a while, we can also dive into what you're currently doing and how we can change it to get more patient acceptance when it comes to cases. Okay. So if this is ever something that you guys need, feel free to reach out to us as well. Okay. Optimizing the workflow. Okay, so this is really important, and I'm sure Brittany and Teresa can speak to this as well. If we don't have a really good system in place when it comes to Invisalign and the whole procedure, it is not going to go well. Okay. First and foremost, are we a digital practice? Do we have a scanner that we can use, or are we taking impressions and sending them in? Okay, so that's the first thing we want to assess. And we also want to know what that process looks like. So if someone's out of the office or someone's sick, somebody knows how they can take over for this person so that the process for submitting Invisalign is streamlined. Okay, there's nothing worse than having a patient have to come back because we forgot extra oral photos, or we didn't take good impressions, or, we missed something in the scan. Okay. Did you raise your hand, Teresa?
Well, I was waving to my daughter good night,
Oh.
but that's, but also I do have something to say. So
Yes.
that worked out well. I think that we're seeing what I typically see as the biggest holdup for things not moving well in practices is generally if you're manually taking impressions, we are seeing, yeah, just not great impressions. And I think every RDA thinks they're the best impression takers in the world. Most of them do. They've been doing it for a long time. And it still sometimes impression material is very finicky. And then just even shipping it changes. Sometimes it doesn't ship well, sometimes cold, hot, like all the things kind of affect it. So I see that slow things down a tremendous amount. The other flip side is scans that aren't entirely accurate or scanned properly. We see that slow things down as well. And in that, even just it slows down a week or 2 week, it bogs down multiple different areas. It bogs down the back end, just in, precious time in like having to retake that stuff. And then it bogs down the front end in the sense that like moving scheduled appointments out, if they pre-booked a bunch of appointments and all that kind of stuff. So as we kind of like go through this stuff, we just see that there's a lot of operations that ends up kind of being needed to be tweaked consistently just to get the practice moving. So yeah, like you said, I think if you have really good protocols in place, and really good kind of like checks and balances, you'll see a lot really smoother workflow, but sometimes that doesn't happen well, or we rush to get things through and then it causes these issues down the road.
Yeah, no, I definitely totally agree. One thing that we notice is the retake and impression rate is quite high among some clinics. And interesting enough, if you are an Invisalign provider and you do have an impression that's rejected, you can actually log into your Invisalign doctor site and they will explain to you exactly what they're looking for and what went wrong in the rejected impression. So something to keep in mind if this is something that's like continuously happening, log in, take a look. That way you can fix what they're looking for or fix the mistake. And hopefully this will be, you only have to send one more impression versus 2 or 3 or more to get what they're looking for.
If that's happening consistently, because I didn't know you could do that, is that newer? Because I feel like that wasn't there before, or has that been there for a while and we just didn't know about it?
Been there for the last 9 months. Honestly, there's so much information in the Invisalign doctor site that sometimes these things just like doctors just don't know they're there, right? Until the issue is brought to me and I'm like, hey, log in, check to see what's going on.
Yeah, because I feel like I didn't know that was there, and I was pretty familiar with the doctor site at one point, but I haven't been on there for a little while, so I could just be newer, like in the last year or so. That's the thing too, is like, is that something you could like help people with in training? Like if we're seeing consistent impressions being taken wrong, or there's like one bog system, they could reach out to you then and like have like a spot training session on that particular problem that we're seeing.
Yeah, we can definitely do that. I actually get updates on like clinics that are doing a ton of Invisalign and their remake rate. So I usually know before I go into a clinic who's having some issues. So it's something I can kind of be proactive when I'm going in, and we can definitely go through best practices for taking impressions for Invisalign. But ideally, if Invisalign is something you really want to implement into your clinic, having a scanner of some kind is honestly going to make your life a million times easier, just with the whole process. When you have a scanner, you can essentially get a yes from a patient on that initial consult or that initial appointment versus having to send in for impressions, wait for the ClinCheck to come back, take a look at the ClinCheck, bring the patient back in, show them the ClinCheck, make sure it's what they're looking for, and then get the yes. So with the scanner, we can usually get a yes within one appointment, whereas actual impressions, we can be upwards of 3 appointments before the patient proceeds with treatment. So it takes a lot of time and energy away from the practice. So something to keep in mind as well. Okay. So another thing, so scanners, sometimes scanners just think it's to replace impression material. Long are those days that is the case, especially with the scanner like the iTero. You're able to actually educate your patients on why you're recommending Invisalign for their oral health. We have so many different tools like the Invisalign Outcome Simulator. We have the occlusogram. We have time-lapse technology that can show the patient where their teeth were and where they are now, especially when you're trying to articulate things like recession or tooth wear. If you have two different scans anywhere from 6 months to a year apart, what you can do is you can overlay the two scans over top of each other, and it will actually toggle between the two different scans. So it will actually show if people are like grinding their teeth and they're wearing, or if the recession has gotten worse, which is really, really good to educate the patients. Okay. We also have another program that we launched recently, and it's called Invisalign Go. Do you guys know anything about Invisalign Go? Britt, Teresa?
I've heard about it, but I haven't used anything. I just heard like the brand. That's it. Like the advertisements.
That's all I've seen too as well. It's just the advertisement of it. Like I haven't actually heard about it. So
okay.
Yeah,
Awesome.
Jenny says,
Jenny.
Is it for short cases?
Yes, Jenny's got it. Okay. So it's not specifically just for short cases, but it is for predictable cases. And essentially it's 6 and 6, upper and lower. So we won't be moving the bite, or we won't be moving the molar relationship. But it is a more affordable type of Invisalign, where the patient can pretty much, they'll know going in that it will be 20 aligners or less. And at 1 week wear, that's less than a year's worth of treatment. And it's very, very predictable. And they can get in and get out of Invisalign pretty quickly. And yes, it's your mild to moderate cases. So it's a really great option.
So you consider that mostly like cosmetic, or maybe class 1 or less, like just barely class 1 type deal, like something that just needs to be tidied up, like mine when I forgot to wear my retainers while I was pregnant, and then they shifted and I need to get them fixed. So like that, when it's like less than 5 months probably of movement and refinement.
Yeah, like honestly, with Invisalign, there are so many different options you can go with. You have an Express 5, an Express 7, and Express 10. So depending on what your scan looked like and the occlusogram, you could probably do that, or you could do Invisalign Go. Invisalign Go is also really good to keep competitive with those do-it-yourself aligners, right? Those ones that you see on like Facebook and Instagram right now. And you just kind of like cringe because you're like, oh my gosh, this is not going to go well. Those are the patients that it's going to be really, really good for, the ones that are very cost conscious. And what Invisalign does with Invisalign Go is they actually give you a report card. So you'll go through and you'll take your extraoral and your intraoral photos on the Invisalign Go app. And then you're going to put in the chief complaints, the ones that you're seeing and the ones that the patient wants fixed. And then it's going to give you 3 different options. Green is a go, and that means it's 100% an Invisalign Go case, very predictable, very easy, like the patient's going to have all their concerns met. Then we have another option, and it's yellow. So when we have yellow, it means it can be done with Invisalign Go, but one of their clinical chief concerns is not going to be met to 100%. So say a patient has like 50% overbite or overjet, it's only going to correct a portion of it. And then that's the time when you can sit down and have a conversation with your patient and say, hey, Invisalign Go is an option for you, but we're not going to have your case at 100%. Then they have the opportunity to make the decision if they want to go ahead with Invisalign Go, or if they want to look at a moderate or a comprehensive case. And then the third option is red, and that is a no-go. we are not doing Invisalign Go. You are going into either a moderate or a comprehensive type of Invisalign. Okay. A lot of clinics are now using Invisalign Go at the new patient exams and as like a pre-intro to Invisalign, because you can easily tell the patient how long approximately their treatment will be. So it's really good for new clinics that are starting to learn, is this going to be a quick case or is this going to be like a full-on 2 to 3 year case?
So they do a scan at the new patient appointment, like, and then they're like, oh yeah, you're a candidate for Invisalign Go. Like they can tell them right then and there, basically they can send it in and have it approved, or like, is it like a couple weeks? Because I know it used to be like a week or two turnaround.
Yeah, so this is an immediate. So if you have a scanner, great, we can do, it's called an Invisalign Go Scan, and it will tell you automatically if it's good to go or not. If you don't have a scanner yet, we can just take the pictures on your phone with the Invisalign Go app, and it will tell you automatically within like 30 seconds.
That's incredible.
Invisalign Go case. Yeah.
Yeah. And if you're using that, I'm just like, as my wheels are turning, because now my business head's kicking in. I'm like, if you're doing that at new patient, and what is the cost difference? Because I know like the case for a regular Invisalign can vary, but like, is the cost difference quite a bit for Invisalign Go, or is it like quite a bit cheaper, or is it just like maybe just marginally less?
No, it's definitely more affordable. And that's why I say it comes into play when patients are really, concerned about cost, or, they don't have any insurance, or, they say, hey, I've been looking at Smile in my backyard and I'm thinking about getting braces by them. Then this is definitely the time when you bring up the Invisalign Go conversation, right?
Yeah. Okay.
And let them know if they're a candidate or not. But it's also great to kind of counter those ones who are kind of thinking about doing the do-it-yourself braces, and being able to show them, hey, I get that you really wanted to do it this way. It looks like a great idea, but based on Invisalign's 10 million smiles, they're saying that this isn't going to go well for you.
Well, and that's exactly it, because even my daughter, I just took her in for her scan to see if we could do Invisalign because she didn't want brackets. Fair enough. She's a girl. They just don't want brackets. And yeah, took her in, scanned her, ran the thing, was like, no, took a rescan, no. And then in the end, was like, yeah, like she can't even get Invisalign. She has to only get brackets, which was disappointing to her. But I was at the same time, it was just nice to know right away what she was a candidate for. And we were able to have that conversation, and was like, oh, the general dentist, like, you know what, you actually need to see an orthodontist. There's a lot going on here. I'm glad that you came here and we scanned it, but it's not what we can do in clinic for you. And so it was really nice to see the scan, the digital images, everything. Like we got to see it all. And we're like, oh, and then she just showed us like, oh, this is why you have to see an orthodontist, because of this, 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 and this. And I was like, holy crap, I had no idea that was even going in her mouth. And we just thought there was just like a few teeth crooked in the front, but there was a whole bunch of stuff happening in the back. So it was just really kind of a good example. That's a perfect example of like what you guys throw. And if you could do that for patients and have that quick turnaround and offer that to new patients. And even just when you scan new patients in general, it just feels like you're adding to the value of that new patient exam. And then obviously you're able to provide the patient with as much information as possible out of that scan. So that's really awesome.
For sure. And like you said, we were talking about this earlier. I got a scan done with the iTero, and I had braces as a teenager, and I was like, oh, I just have like 1 or 2 teeth that like kind of relapsed when I had kids, and same kind of thing, didn't wear my retainers. And after I had the scan done, I was like, oh, okay, I have a lot more going on in my mouth. Like this whole one side was lighting up red, which means it's all true points of contact. And yes, it might look aesthetically pleasing now and everything might be fine, but what is that going to look like in 10, 15, 20 years, right? Especially if I'm clenching or grinding, I'm going to be wearing my teeth unevenly, and like, what kind of issues is that going to cause long-term for my mouth? So, yeah, so I'm actually in Invisalign now too. And instead of being like an Express 7 or 10 that I expected it would be, I'm in 31 trays. So until you get the scan or your patients get scanned, sometimes they don't really know what's going on or have any ideas what's going on in their mouth because they've never been scanned before and no one's shown them what's going on, right? To see it is completely different than being told like your pocket depths, 121, 321, 1 millimeter of recession. Like, what does that mean to us as patients, especially outside of dental, right? Whereas if you can actually show the patient what's going on, it has a much larger impact. And they can really see what you're trying to explain. So yeah, scanning is super important.
Yeah, visual aids are incredibly important and they're such a useful tool just in, I mean, I say this all the time, like dental is no longer just like dental. People, you say it and they believe it and invest in it. Dental, no matter what position you're in, if you're an RDA, if you're a treatment coordinator, if you're an RDH, if you are front end administrator, you're in dental sales now, because that's really what it is. And not that we need to be selling product that isn't necessary, but I'm saying dental, everything that you're dealing with needs to be sold to the patient because the patient needs to see value in it in order to invest in it. And if you can't show them the value, they won't invest because there's a lot of other things buying for their time, energy, attention, and money. So you have to show them that there is value in this and why taking care of yourself and taking care of your mouth is important. And this is all, these tools allow you then to kind of broadcast that forward.
Yeah, I totally agree. I just want to kind of go back. We kind of got like sidetracked with the Invisalign Go app. So you can download the Invisalign Go app on an Android or an iPhone. And there's a couple different really good tools in there. I don't know if you guys can see if I can make it close. Oh, there we go. There we go. So we have the Smile View Outcome Simulator. And then at the bottom, we also have the patient management. And the patient management is where you would actually add in your new patient or your candidate for Invisalign. And when you get in there, it's really simple and easy. You add their name, you add their information, and then it actually, let's see if we can do this again, if I can get a good angle. It actually walks you through all the photos you need to start an Invisalign case, okay? Which is really nice. So it tells you, you need a mirror with this one, you don't need a mirror. When you go to take the picture, it actually helps you line up each of the arches. It puts a smile so you can actually see it. So it makes it really streamlined and easy to use. And you don't have to worry about, oh, did I take the upper occlusal? Did I take the lower occlusal? Did I take the wide smile? It will literally add them as you go. So it's a really great tool to use. And especially if you're just looking at getting into Invisalign, this is something that's going to make your life a lot easier. The other nice thing with these pictures is they all automatically go to the Invisalign doctor site, and they can also be downloaded onto the computer and put into the patient file as their new patient pictures or updated patient pictures as well. So you don't have to make duplicates or grab out the SLR camera and take them that way and then download them onto your computer. So something to keep in mind. Okay. So the other pillar to success when we're talking about Invisalign is the hygiene PCS model. Does anyone know what PCS stands for? No. Anybody? Anybody in the chat? Care to guess? No. Okay, so hygiene PCS is, we're going to talk about malocclusion in a problem, consequence, and solution model. Okay. Oh, someone did chat. Nope, sorry.
Yeah.
Thanks for responding, Michelle. So you always want to talk about the problem. Okay. Like you said selling, but I also don't like to say selling. I prefer educating when it comes to our patients. I think it's like the hygienist in me too. I think selling just sounds like used car salesman. So I try and stick away from it as much as I can. We want to say things to the patient like your teeth are in trauma, or, we're seeing recession, you have tooth wear. And then we want to talk about the consequences, right? Consequences is so important. So what do the consequences look like? What do they look like in 5 years? What do they look like in 10 years? What do they look like in 20 years? Right? And you want to link them. If we don't use the consequence, like I said before, you're going to sound like a used car salesman. So then we're going to offer them a solution. And instead of saying Invisalign, I like to say clear aligner therapy. And then we want to say that we're taking the teeth out of trauma, putting them into the right position so that we're able to keep your teeth for a lifetime, right? And just an example. So say you're the hygienist and you have a patient come in, you're scaling the teeth, there's a lot of crowding on the lower anterior. And as you're cleaning the teeth, it's just such a simple conversation. You can say, hey, Mary, as I'm cleaning your teeth, I've noticed you have a lot of crowding on the lower anterior. There's a fair amount of buildup. And as I'm cleaning your teeth, there's also a fair amount of bleeding. Has anyone ever talked to you about aligning your teeth so that it's easier to clean in between them? We're going to get less buildup and hopefully less bleeding. How does that sound to you? And then Mary's going to say, no one's ever talked to me about that. This is the first time I'm hearing it. I had no idea. Or Mary's going to say, oh, okay, interesting. Let me think about it. Or the other option is Mary's going to say, yeah, that's okay. I don't mind coming to see you and doing 4 units of scaling. I'll see you in 6 months, right? But at least we've educated Mary on what was going in her mouth, what the consequence of it and the solution could be. Okay. So starting with little conversations like that makes a huge difference when we're incorporating Invisalign or clear aligner therapy into our practices to get patients interested in it and get them to say yes. Okay. Any questions so far? Okay, awesome. So another question, why do we talk about malocclusion with every patient? Why is it important? Well, like we talked about earlier, it is a disease, so we're actually obligated. It's not just important, it's actually our duty. So we need to kind of shift our thinking from like, oh, like if they wanted braces or they wanted straighter teeth, they would say something. But a lot of patients have not been educated on why aligning their teeth is important to their dentition, right? Think about it like that. Okay, so I absolutely love this picture and you guys are gonna have to play a game. If you've seen this presentation before, you're not allowed to guess, by the way. But based on the teeth, how old would you guys guess this patient is? No right or wrong answer, just we'll play a game. Oh, we got some guesses.
30, 20. I was going to say like late 30s.
Late 30s?
Mm-hmm.
Is Britt going to guess? Oh, I was going to say 35.
Brian's going to say 35. Yeah.
Awesome. Okay, so that's pretty young. Like, so based on this, the occlusion looks pretty good. The tissue looks pretty good. The teeth look in decent condition, right? Well.
Oh, wow.
Boom.
Should have looked at the lips because if you go back to that thing, her lips have like, yeah, I didn't see that. That's smart. You guys are tricky.
Right? So what does this tell us about her teeth and how well they fit together? Right? So she is actually in her late 60s. Believe it or not.
That's fantastic.
I
Oral
know.
health right there. That is like the pinnacle of oral health. What we
Right?
all need to be when we grow up. She probably flosses twice a day.
Oh gosh, I wish I could say the same.
Yeah, me too.
So bad. So yeah, so this pretty much shows us that based on her health and her age, honestly, unless something like catastrophic happens, or she has a change in medication or something like that, her teeth are probably going to last her a lifetime if she's already made it to her late 60s and her teeth look so good. But this also shows that teeth last a lot longer when they're in proper occlusion and they fit together properly. Okay. How often do you guys talk to patients who still believe in 2022 that they'll probably end up in dentures one day? Probably still a few of you.
Every day. I think it is too more prevalent in rural practice than it is in city practice, because I think the influence is higher in cities for like aesthetics. And that's usually a pretty sheer driver for keep taking care of your teeth is like, but yeah, rural practice, when I was working in rural practice, it literally was like, well, I'm just going to get denture. I'll just get a denture. And you're just like, really? Like, really? We're here in this age? And like, you have an iPhone 13 and you want a denture? That seems strange to me.
Right. But if we think about it this way, if a patient says like, oh, I just think I'll end up in dentures, what if we aligned your teeth so they fit together properly so that you could keep your natural teeth and be more comfortable and have way less issues? And probably in the long run, it's going to cost them a lot less money because dentures are not cheap. They're typically not comfortable. Even like the best made dentures usually have some kind of issues going on, right?
Well, and if you want the best made, then you're getting implant supported dentures, and implant supported dentures are very expensive. And then, yeah, just realignments and like gum tissue stuff that goes on. And yeah, the comfort, there's a lot of things in dentures that are not fantastic. That's why we went to implants, and we're seeing success in implants and bridges and trying to keep our natural teeth as long as possible, because the success rate and actually just like the patient acceptance of like, they accept the treatment plan and they think it's a great idea, but then when they go to wear them later on in life, they don't accept them because they don't wear them. So
yeah. So this is kind of like back to the whole, like, let's be proactive with our patients. And it's funny, I'll go into a lot of clinics and they'll be like, oh yeah, I talked to my like 20-year-olds, my 30-year-olds, and like maybe like early 40s all the time about aligning their teeth and malocclusion. And we're having such great conversations. And I'm like, okay, that's awesome. What about your 50-year-old patients and your 60-year-old patients and even your 7-year-old patients and even 80-year-old patients? Are we having malocclusion conversations with them? And a lot of the times they say, no, I'm not having those conversations with those patients. No, they don't think it's for them, and they're old, and they wouldn't want to do that. So why would I even bring it up? No one's ever told them that they could do this or that they need it. So if I bring it up to them, then I'm going to look like bad, right? Who else kind of thinks that? That's kind of like a preconceived bias to our patient. But if I showed you guys what ages are going through with Invisalign, and I get to see all the ones in my territory, I can tell you there is a lot of 50-year-olds, a lot of 60-year-olds, a lot of 7-year-olds, and even some 80-year-olds that are moving forward with Invisalign. And why? Why do you guys think? Why would they want Invisalign? Any guesses?
I can tell you why my mother-in-law wants Invisalign.
Yes, please do.
Yeah. Okay. Well, she wants any type of ortho because she, one, hates the way her teeth look. And two, because she just finds that everything gets caught in everywhere and it's difficult for her to clean her teeth because they are crowded, and she has some like teeth that have drifted forward and some that have drifted back into her mouth. And so chewing has become difficult, and she has open contact, and so she can't even chew food properly. And yeah, then you have to change your diet, and your diet's not great, and she doesn't like that either. So yeah.
That's such a great example of somebody who's older that wants it for a reason that we wouldn't even like have thought of had the patient not had the conversation and brought it up, right? Some of the other reasons that older patients want to go forward with Invisalign, maybe they never had the money when they were younger. Maybe they've been raising their kids and putting them through, school and college and sports, and it wasn't an option for them, right? Financially, or maybe nobody told them that they could have Invisalign and they just didn't want to go with traditional braces, right? Or maybe they want to set up for a restorative case or veneers or whatnot. So I think we all need to like shift our thinking as dental professionals and kind of remove our biased thoughts or our preconceived notions about our patients, and at least have the conversation with them. And if they're, not interested at all, then that's fine. At least we can note it with either a code or a note in their file that the conversation was had. Patient is interested, patient is a little bit interested, but not right now. Or maybe the patient never wants to be talked about ortho again. And that's okay too, right? But at least we know we've had that conversation and done what's in the best interest of our patient long-term. Okay, so try and keep that in mind. How are we for time? 2 minutes, okay. Okay, so what does the opportunity look like in a practice? So this one actually kind of really shocked me when I joined Invisalign. The stat, 75% of the population, kids, teens, and adults, could benefit from straighter teeth or fixing the malocclusion, okay? So 75% in a day, 7 out of 10 patients in your hygiene chair or dental chair have malocclusion, okay? And how many patients actually end up in ortho treatment? Probably not 7 out of 10. But there is opportunity here. And if you're actively screening and actively talking about malocclusion, it's going to translate to a lot more cases, okay? You can actually work out these numbers for your own individual practice, and it's actually really interesting to see. Over the last 9 months, I found it really, really interesting. I have some huge clinics and I have some single practitioner clinics. And it's been pretty crazy to see how these different clinics have been able to grow their Invisalign. And they're not growing it from a sales perspective, they're growing it from an education perspective because they believe that malocclusion is very important to their patients, okay? I've seen single practitioners go from doing like 3 or 4 cases every 6 months to hitting gold plus, and I even had someone hit platinum. And this is like a 2-doctor clinic in rural Alberta, and they just put malocclusion as one of their pillars to treating their patients. And it just, like, it was a lot of work, don't get me wrong. They worked their butts off. They like literally killed it. But they talked about malocclusion with every patient that needed the conversation. They educated them using the right words. They had all the different pillars in place to be successful, to have a streamlined practice, and they killed it. Like, they did really well, and their patients are very happy with the results. So I know a lot of people think like, oh, I'm just like a small clinic, but literally anyone can do this. If we just put an emphasis on malocclusion, non-Invisalign, always malocclusion, and what's best for the patients. Okay. So like we said before, typically when we talk about clear aligner therapy or Invisalign or something like that, our minds and our patients' minds typically go to aesthetics. We're straightening our teeth so that they look good, but there's so many other aspects. We need to be educated so that we can also educate our patients on all the other benefits of aligning our teeth. Okay. So one really important one is improving the health, the periodontal and the periodontal occlusion health as well. Anyone who's worked in a perio clinic can definitely attest that malocclusion can definitely contribute to issues going on in the dentition. Okay, pre-restorative case setup. I love this one. Maybe because I'm a bit of a nerd and I sold composite and bond for various different companies over the last 7 years. I worked with Cavo Kerr and Voco and Dentsply. And when I would go into a clinic and a doctor would have an issue with a product or restoration, what would we look at? Any guesses, Teresa?
I think you would be looking at everything that they're doing restoratively and trying to figure out what their flow is and what they have when they're talking to their patients and what they have their setup is, like all of their equipment, everything that they're looking at from start to finish.
Exactly. We go in and we look at what composite are you using? Which bond are you using? Did you read the IFUs? Because everyone reads the IFUs. They're like this thick.
Yeah.
Right. And then it was, okay, so you're using my bond and my composite together. So those two should work really well together. So that shouldn't be the issue. How are you storing that product? And then how are we placing that product? Did you line the proximal box? You know, did you pack it? Did you do this? Like there's so many different things that we looked at when a product failed, but we never looked at, hey, despite all those factors that we just talked about, was this restoration or was this crown always going to fail because the teeth were out of occlusion?
Yeah, it's so interesting because just skipping into other parts of dentistry where we have found that, and we've done like implants where we did implants on a patient and the teeth were out of occlusion and torqued it, broke them. I've seen implant failure. I've also seen we did a bunch of crowns on a patient with who had bruxism, and then also the bite wasn't set right and they were in occlusion and broke them all within I'm not talking months, within a month or two, they busted them all off at the gum line, one at a time, ding, 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 because they just not an occlusion. And it's something that you learn. I think most dentists learn at a young dental stage when they're quite young into the dental game. But it's quite a prevalent problem that people don't think about until they've had that happen. And then they're like, everything's failing and failing and failing. Eventually you have to weed out that it's not the equipment, the bond, the thing, the user error. It's literally something's wrong with how the mouth is operating.
Exactly. Are the teeth in trauma? Are they out of occlusion? All these sorts of things. So something to keep in mind, because I'm sure everyone has heard a patient come in and say this restoration or this filling keeps coming out, or my crown won't stay on. So always something to educate the patient about, because a lot of the time they look at, oh, my last dentist, this always came off. Or, they come to see you and it's like, oh, the doctor placed this and it keeps coming off. Okay, well, I get that. But we need to look at your occlusion now. Okay. So this is also like a conversation, not just for Invisalign, but talking about their occlusion, because a lot of the time they don't believe you. They literally just think that it was not placed properly. So definitely keep this one in mind. And any big cases should definitely have the occlusion checked before going ahead, especially when they're spending like $10, $15, $20, $50,000 for some of these full mouth rehab cases. the last thing we want is them to fail or to have issues with it down the line because their teeth are out of occlusion. Okay, minimally invasive. That's definitely the push in dentistry right now. And sometimes if we can align the teeth, there's a lot less issues that will arise in the future. So keep this one in mind. Aesthetics, always a benefit. Everyone wants nice teeth, especially when they're on Zoom and Teams and FaceTime for the past 2 years. The amount of Invisalign and Botox cases have just like gone through the roof because of our situation for the last couple of years. Okay, and this is another always important one. Referrals, a healthy patient equals a healthy practice. Okay, so we're gonna play this game again. I want you guys to guess how old this patient is and what would you typically recommend for treatment?
Well, he needs a cleaning. Right off the bat.
I
There's
agree.
probably some 14, Britt saying. I think there's some definite pretty strong staining on there. There is some gum recession, which typically wouldn't come till later in age, but that doesn't always mean that happens. There's just usually some. And there's some teeth drifting in there as well. I'm going to go with 46.
46. And then we have a guess of 25, 50, and 37. Okay. So, yes, I know. You say that, but this is like a common procedure.
I know. It just grosses me out. I work in dental. I'm weird. I still don't think it's attractive. But I like the end product.
Right. But if you wanted veneers, would some offices offer this treatment still to this day?
Oh yeah, 100%. Let's fix it with veneers. That's a lot of people do
right?
it. Yeah.
So imagine if you showed the patient a picture of this prior to getting veneers, what do you think they would say?
What I just said. Ugh.
Ugh. Yeah, exactly. So most people would be like, no, thank you. Okay, so this is our before and our after. Boom.
Oh, that's really good.
So these are amazing results, like so amazing.
Is there gum grafting on that? Wow, that's impressive. Really impressive.
So with this specific patient, it was cleaning, oral hygiene education, Invisalign, and then we also gave him a tube of whitening, and he whitened throughout his treatment. And that was it. But you can see like where that recession was. Most of that recession was being caused by trauma, and like it's not 100% fixed, and it didn't, like it probably never will be. But the results that you're seeing are pretty impeccable. And that's because like there's a bit of a crossbite there, and those teeth were literally in trauma, right? Those upper teeth were literally hammering on that bottom teeth, and it was just causing the gums to recede.
I want to know how old that patient is now.
It's coming. Okay, so here we go.
Wow.
And essentially you've changed Jared's life. Okay. This is something to get excited about. He lost 25 pounds, got a haircut, his complexion improved throughout his treatment. And think about what this means to your patients and Jared's life. He now has the confidence to interview for a new job or gets a girlfriend. The list goes on. Okay. So Jared was, drum roll, 23 when he came into the clinic.
Michelle, I think, was closest. What are we at? Yeah, Michelle's at 25. Yeah, so close.
Right?
Winner. Brownie
It's
points to
literally-
you.
It's insane. And the other thing is, like, throughout his treatment, he also lost weight on the Invisalign diet.
Oh yeah, I did too. It was great. Yeah.
I'm still waiting.
Okay. It was great because you can't snack. And that's like how I live my best life is snacking. You can't snack.
Snacking.
I learned, which is really bad, and this is not good to tell people, but I learned that you could break off a piece of an Aero bar. And if you put it just slightly back behind your retainers and suck the chocolate back fast enough, it didn't get into your trays. So that was the only snacking that I could do.
That's actually awesome.
Yeah.
I'm gonna try that. So with this example, like, we didn't just fix his oral problems, like we literally improved his life. His confidence was back. And 7 years later, he is still a patient of this doctor. And he is one of the best referral sources that she has, because his transformation was just so notable, and not just for his teeth, but his happiness and his confidence that he exudes, right? You can just see it. So really, really important to keep in mind. How are we for time? Oh, one minute, eh?
Yeah, you're close. You can finish up if you have.
Okay.
Yeah,
Oh gosh,
go ahead.
this is like, I have 131 slides.
Oh,
We're not finishing. This is like the tip of the iceberg when it comes to all there is to like learn about Invisalign, malocclusion, financing. So we'll definitely have to put a pin in it here. I can
Yeah.
answer any questions if anyone has any.
Sometimes it's hard to type off your phone. I was gonna say, we'll probably have to have you back again later to another one, and just to go over, I think, the financing aspect of it, because I think that's a huge part, like how to have those conversations, how to break it up in pieces where the patient will accept the financing part of it. And then, yeah, I think it would be a fantastic
You know what, that, yeah, I was just thinking about that too, Teresa. Holly, it would be awesome to have you back. There was a couple people who actually reached out over Instagram that said, oh shoot, I'm too late, I wanted to come to this, and hopefully it's recorded and everything. So it would be actually awesome to have you back and then do the financial aspect of that. So whenever you have a chance,
Yeah, for sure.
I think that would be great.
We
So
can definitely do that. And if you guys have any questions, you guys can reach out to these guys directly, or you can reach out to myself. I'm more than open to that as well.
Yeah, we'll 100% put you in contact with Holly. No problem. Thank you so much for coming on tonight. We really appreciate everything that I've learned. I mean, I like the questions about trying to guess how old those patients are. But it was very engaging and very interesting to me. Just even the background about things that I had no idea, and I've been in dental for a long time. So you queued me up to get more interested in it and learn a little bit more and help my practices with it. But yeah, we definitely would be super happy to have you back and just educate us a little bit more on what you have going on in the support system that Invisalign has built. Obviously, it's probably the most prevalent clear aligner in North America right now, and there's good reason for it. You guys have an awesome support system, and we're super happy to have you in our area. And yeah, reach out to Holly through Invisalign if you need. And other than that, we will call it a night. We appreciate everyone that came up tonight, and obviously this will be recorded and put onto YouTube, which Holly's information will be linked on as well, so that you guys can reach out to her.
Awesome.
thanks so much,
guys.
Holly.
Have a good night.
Thank you. You too.
Okay, cheers everyone. See you next month.